Hey everybody, welcome to Sandstone Cares podcast series. Today I'm joined with Darren Hoffer from Newport Academy. Darren, welcome.
Thank you, Drew. Hello, everyone.
So Darren, let's get started and get right into it and maybe tell us a little bit about what your background is and how you got into the field.
Sure. Thank you, Drew. It's been a journey for me. I started in more of in a business field a while ago, my early 20s, and then realized that I had a passion for helping people that had mental health related issues, and a lot of it was familial related. I had some family members that had gone through some different experiences, and I saw complete transformations, and I was just astounded by psychology and the way it worked. So I went back to school for psychology, and then continued on through grad school in clinical psychology. And then ended up doing some clinical training and clinical work myself, and worked for several behavioral health providers until I found my true passion with Newport Academy.
Nice.
Yeah.
Tell us a little bit about what Newport does.
Newport Academy is a series of holistic treatment centers for teens. Teens being classified anyone from ages 12 to 20. And some of that is dependent on the licensing of the facilities where they are. So in California, we treat kids that would be ages 12 to 17. Mm-hmm. And in Connecticut, it's ages 14 to 20. So because of that, the West Coast tends to trend a little bit younger. So when we have younger kids in need, we may try to get them there if it's more appropriate. And then obviously if we have some kids that are 18, 19, or 20, Connecticut would be the option.
Gotcha.
How that looks, though, for me, the passion with Newport Academy comes from our treatment model, the model of care that we provide. So it's been a vision of our founder, Jamison Monroe, and our chief clinical officer, Dr. Nozel, for many, many years, and it's been evolving, and we've been tracking data on the efficacy of our model. And I think it's truly unique in a lot of different ways, but one is comes down to how we treat, and we treat in small groups called therapeutic pods, and each pod has a general diagnostic criteria, as well as some there may be some age variance in there as well. And then each therapeutic pod has a primary clinical team of 3, so they have a primary therapist, a family therapist, as well as a counselor. So between that primary therapeutic team, they have 5 individual sessions per week, so they get a lot of individual attention. And as well as the caseload is oftentimes burdensome for therapeutic personnel. Yeah. So each one of our primary therapists has a caseload of 6 or 7 on average, which is great for them. And they're the ones that provide most of the evidence-based modalities. So whether it's cognitive behavioral therapy or dialectical behavioral therapy, the primary therapist may run the DBT group. Counselor might do some DBT skills, and then the family therapist is the coordinator of it all, coordinating with any kind of referring therapist, outgoing therapist. They conduct weekly family therapy, and then they're also the facilitators of the weekend family educational sessions, which to us, we are a treatment center for teens and their families. So having the family get help while the teen is with us is really paramount to our process. So even for families that might be coming from further away, it is important that they participate in family therapy, and we do that through a secure video conferencing site.
Sure.
And then obviously encourage them to come out for the family weekends, because it's a big part. There's a family support group, psychoeducational activities. We do some experiential activities, so the parents get to see what their kids are going through, and they get to experience some of that together. And then I think most beneficial and really most touching for me is the whole family support group at the end, where the families, the kids, and the family therapist all sit in a room together. So you have the teens that are just kind of coming in, and they're not too thrilled about being there, to put it lightly, and then you have the ones that have been there for a while, who have parents have seen great change. The teen themselves has changed dramatically, and they get to express and share that on a group level with some of the other families and teens. So that is
very cool,
a big impact of what we do.
Yeah, and who's the ideal client that you guys are working with? You say teens. Is it? What are most people coming to seek your services for?
So most of the kids that come to us, the majority of the kids that come to us, have a primary diagnosis of mental health. Of those, most are related to anxiety or depression. Depression is something that's on the rise in teen populations, especially in certain with certain segments of the population, of the teen population. We're seeing more teen suicide ideation and suicide attempts than ever before, which is alarming to mental health professionals, and it's something that I'm personally passionate about. So we do our best to combat that. Our model of care has been shown to be effective in reducing symptoms of depression over 24 months, or 12 months, 24 months, 36 months, and we actually have some of that data on our website. So we're constantly tracking the ongoing efficacy of our model of care.
Very cool. And I know today, for this podcast, you came here and you wanted to kind of share something you're really passionate about, and so I'll let you kind of introduce that to our audience and share some.
Yeah, thank you. So one of the things that I'm truly passionate about is depression, both in adults and obviously in teens as well. Piece of our treatment model that I left out earlier is our experiential treatment that we provide on campus, which is a large portion of what we do. So outside of the primary clinical team for the therapeutic pods, we have our experiential clinical team. We have licensed and certified art therapists, music therapists, equine therapists, and then we do some activities outside of that as well. We have martial arts, kickboxing, on different coasts. We do some agricultural work, so we're like growing crops either in a greenhouse or we're fortunate enough in California. The weather is a little different than here on the East Coast, so there's very minimal rain. Yeah, there's lots of sunshine and minimal rain. So with a little bit of watering, crops can grow year round, which is great. And so we do those things, and then we also do 4 hours of adventure-based activities with the kids each week. So that's going to look like rock climbing, hiking, river rafting, surfing, if you're in California, and other outdoor activities. And I go through all of that to kind of talk about depression, because that is something that I want to talk about now. And one of the treatment modalities for depression that is getting more recognition lately, there was actually just an article published in JAMA Psychiatry recently about the use of resistance-based training, so which is just kind of like a fancy way of saying strength training, weightlifting, if you will. So, but you don't necessarily have to lift weights. Although, we can do that. Even at our treatment center, we have weights and exercise equipment for the kids to exercise, because exercise is very important. But we also do some other things on campus related to strength-based activities, and it's something that is also up and coming, and becoming more popular in society, and that's yoga. So when we think of yoga, sometimes it can be thought of more as a breathing-related exercises, but ultimately different positions in yoga are really core and strength-based activities, and can actually be very beneficial to in the reduction of depression symptoms.
And those, I think one of the things that's really interesting and often, a point of understanding is something that can be used to treat and cure something, or something that can be used to kind of ward off symptoms as an as needed or PRN type of modality. And how would you describe that type of exercise, whether it's the yoga or the strength-based, with regards to depression? Is that something they're saying should be done, kind of as needed, and you're feeling the symptoms of depression, or is it something that they feel, if done enough, could really just ultimately reduce depression?
No, overall? It's something that needs to be done on a regular basis. It's not as fast acting as some pharmacological therapy would be. So it's not that if I'm feeling depressed today, I can go to the gym and do some strength-based activities. Although that helps a lot of people.
Mm-hmm.
If they're having a bad day, they can go to the gym and kind
Sure.
of relieve stress and builds self-esteem and so forth. There's a lot of other things that can go along with that.
Yeah.
However, the published article was talking about doing it 3 to 5 times a week. So it was on a regular basis doing
So I need to get a gym membership, is what you're saying.
Yeah, or a yoga mat.
Okay.
Yeah, they're cheaper.
Yeah.
Or YouTube's great. You can
Yeah.
get a lot of activities, exercise activities off of YouTube, especially for the beginners out there. Like if it's something that you're just starting out with. I know from personally, 6 years ago when I started engaging in physical activity again, it was an arduous task, to put it lightly. And now it's something that every day it just has become part of my life.
Yeah. You notice when you don't do it rather than when you do.
Correct.
Yeah. Exactly.
Yeah.
Very interesting stuff. And so, kind of wrapping up, thinking about if there was one thing you would want to share with our listeners about yourself, about Newport, about depression, or something other than that, what would it be?
Really is a message of hope.
Mm-hmm.
I want to express a message of hope. For any parents out there that might be struggling with a teenager, going through adolescence is hard enough, and when you add a mental health diagnosis or some other technology related issues on top of standard adolescence, oftentimes as a parent, and as a parent myself, these struggles become very real, and oftentimes parents don't know what to do. They don't know where to turn to. But thankfully, there are facilities like Sandstone Care and like Newport Academy that can help parents navigate that process. And again, so for me, a message is really that there is hope, and no problem is too little. So if you're thinking that if you're potentially waiting for something greater to happen, don't wait. So we can stop it before it gets that bad.
Yeah.
So and that's really the core of a lot of the treatment that we provide, and that's the message I'd like to convey.
Yeah. Awesome. And where can somebody learn more about Newport Academy?
A website is a great place to start. Obviously you can go to newportacademy.com and check out what we do. You can find some of our efficacy data on there. So if you look through the website, you can see what our model of care is, and then the efficacy of our model of care. And so that's always a great place to start. Or, they're a local therapist or doctor's office, or, just be sure to talk about it.
Yeah, absolutely. Darren, thank you.
Thank you, Drew.
Thanks, everybody, for tuning in and watching this podcast at Sandstone Care, and we'll see you next time.